There are so many things that we all can be doing to help be prepared for the onslaught, really, of dementia and how it's going to impact all of our lives. The number one thing is education. There's still a lot of misconceptions, a lot of stereotypes, and fear about Alzheimer's disease, which is really blocking out the knowledge that's so important and so needed. I think all healthcare professionals need to have basic information about Alzheimer's disease, how it manifests, and how we manage someone who has an illness when they have Alzheimer's disease. I think everyone needs to know about the resources that are available in their community so that patients and families can be referred for appropriate support. And if those resources don't exist, then we need to work with our legislators, both local, state, and federal, to help make sure that those programs are in place to help support families. I really call Alzheimer's disease a foundational disease because when someone has it, it means that we're not going to be able to easily manage other medical problems that they have because they're going to need help in communicating and understanding how to take medications appropriately, how to follow diets, or how to really get through the day and manage other diseases. So for example, I often say if you have a patient who's having difficulty controlling their blood pressure, that may be someone to do a screening to see if they might have some cognitive impairment because they may not be able to understand how to take their medications appropriately. If you have someone who you're having a hard time controlling their diabetes, especially if they're older, make sure that they are not developing some of the signs of memory loss that could indicate dementia and cannot follow a diet or cannot remember how to take their insulin properly. So that Alzheimer's disease affects every aspect of an individual's medical care, how they exist in their communities, and how they function on a day-to-day basis.